Good morning, guys. Tony Maritato here. So, I want to answer a series of questions that came in from an individual. This person's been extremely patient. I can't answer a lot of questions from viewers, but this was one that I wanted to get to because I think it's going to help a lot of other people. So, this individual is 11 months post op, right total knee replacement. I'm reading from my screen. This person did PT for the first 6 months religiously every day. That sentence right there starts to give me a little information about this person's personality type. I think this is important when we're looking at prescribing or making recommendations for individuals. You have to know who to push. You have to know who to hold back. You have to kind of understand who you're working with. So they did PT every day religiously for 6 months. That's a lot. I do some PT from time to time now, but my knee seemed to be stabilized after the first 4 months. And that makes sense. Like, you make most of your gains. I would even say during the first 3 months, you make most of your gains. Then over the next 6 months, 12 months, up to 2 years, there might be marginal improvement, but it's not going to be any kind of, significant improvement like you get during those first 12 weeks. Did I say months? I meant to say weeks. Okay. As of today, the knee remains about as swollen as it was at month 3. I have considerable pain with walking up and down stairs, which has improved slightly since September, but it's not really functional. I have a fairly large amount of clunking in the knee. That clunking is something that we're going to talk about here. In December, the surgeon did blood tests for an infection, came back negative. I have interviewed several surgeons, talked to them about infections. It's really hard to determine, like, is it an infection? Is it a sensitivity to the components? Why does the knee remain hot, swollen, red, warm to the touch? I would say most of that is associated with either an immune response. Doesn't mean that you're allergic to the implant. It just means that your body recognizes that this is a foreign element inside your body. Or it's related to lymphatic damage. There's a lot of lymph vessels. They get damaged during the routine procedure. And so if you're not able to get some of that lymph fluid back out, it certainly could present the way you describe. And a lot of times, there's not a whole lot to do. I would recommend you get a consultation with a lymphedema specialist. They may be able to provide you with some strategies to help support the lymphatic system. Even if it's not solely a lymphatic problem, you can at least get some education and information on what you can do. Goes on to say the surgeon recommended knee ablation to reduce the pain in the knee. I had test injections performed in early December. I received some relief. I've not proceeded with the ablation. I'm not certain that it would give me much relief. I question whether it would help the swelling. The ablation is not designed to help swelling. Certainly, if the ablation was going to work, you would feel more significant improvement than you described with the initial injections. So I'm with you. It doesn't sound like the ablation is the solution to your problem. He said that I'm assuming it's a he, I don't know, currently ices the knee twice a day after activities. So you can tell this is a very regimented person. This is, the mindset, the mentality of somebody who you tell them what to do and they're going to do it. And they're going to do it exactly the way you tell them to do, and they're going to do it as often as you tell them to do it. It's that kind of engineer mentality. I don't know if this person is an engineer or not, but there are those very engineer analytical minds, and there are more of those kind of creative minds. This is kind of a very regimented individual. The surgeon we already read that. December, had a CAT scan, showed swelling. You knew that because you can feel it. X-ray was normal. It usually is. I'm interested in getting a second opinion. He said that his range of motion was, flexion 120, 125, lost 25 pounds since the surgery, was hoping that that would help, but hasn't really made a difference. So let's get into this. Let's talk about the couple of the elements here. First, I want to say, I don't know you. I'm not prescribing anything for you. I certainly haven't done an evaluation on you. So, this is all just for education purposes. But in my mind, the first thing I do is I try to match what I'm about to say with the personality type that I think that I'm talking to. And I think that you're somebody that wants a solution. You're somebody that wants an answer to the problem, and you're willing to work as hard as it takes to get that answer. But I'm going to tell you, I don't think there's an answer. I think that from your numbers, your range of motion, you're doing great. Functionally, it sounds like you're doing well, just not as well as you want to be doing. And the continued impairments, an impairment could be pain, it could be swelling, it could be instability, all of those things that you're describing. I see them with other patients. I'm not going to say they're normal. I'm not going to say they're common, but I do see them frequently enough that I recognize the pattern of symptoms. The one thing that I would say, really stands out to me, though, is the clunking. And I would say the clunking, in my experience, when I'm working with my patients that I've examined, that I've put my hands on, that I've assessed their knee stability, the clunking is usually consistent with some instability in the supporting structures. So either the medial or lateral collateral ligaments, those are the ligaments that run on either side of the knee, something related to the joint capsule, something in there isn't moving quite right. It is possible, and I've shared other videos, where the fibular head, the fibula, is the bone that runs along the outside of the lower leg. It comes up, it attaches under the tibia, just below the knee. It's technically not part of the knee joint, but when you flex and extend your knee, that fibular head, will kind of move around, and sometimes it'll clunk. And I've had patients, whereas the tibia moves, that fibular head clunks, it produces pain, it produces swelling, sensitivity. The lateral hamstring comes down and attaches into it. So it could be something associated with that. It could be something associated with instability in the ligaments. I really don't know, but that would be something that I would pursue a little bit more. But I would honestly say that is probably a separate issue from the warmth, the swelling, the redness. I think the warmth, swelling, redness is either your immune response or it's the lymphatic system not quite being able to do what it needs to do. And then separately, you have this clunking or instability that's coming from one of the actual structures, not related to the implant itself, because the X-ray confirmed the implant is in a good place. But these are two things that I would talk to either a lymphatic specialist, lymphedema specialist, see if they can help you. That could be a PT or an OT. Or I would talk to kind of a therapist that has a little more of a biomechanical background, somebody who's going to assess how the shin, which is your tibia, the fibula, the ankle, the hip, all of the surrounding structures are working together, just to see anatomically what is causing that clunking that you're feeling. But overall, I think what's probably so hard for you is you want to be better, but I think the people that may be assessing you are thinking you're doing great and just give it more time. The normal answer is give it more time. I never really find that to be the solution. But I think that's what patients are told when nobody really has a clear, defined answer. And I certainly don't have an answer for you either. So I don't want you to think that I'm claiming that I know what needs to be done. But those would be my two suggestions: to have further assessment done. Look at it from a lymphatic system perspective. Look at it from a mechanical perspective. Both of those could be therapist evaluations. Both of those would be covered by insurance. And then from there, you can start to make plans on, okay, how do I improve this situation? I hope that was helpful. Thank you so much for your patience. And anyone else who has questions, I will do my best to get to them, but there's a lot of questions. Thanks, guys.